Well, hi of all of you. It's great to be here at the Global Life Sciences Summit once again. What am I going to talk to you about? The crisis in healthcare and the fact whether AI can be a cure to that crisis. Let's have a look at what's happening in healthcare. Let's go to the next slide. There is definitely a crisis going on in healthcare, and I travel in my role. I travel the world, visiting healthcare systems in 6 continents, and I can assure you, every continent has crisis in healthcare. What's happening? We have an increasing care demand due to aging and growing populations, increased non-communicable diseases, a shortage in workforce, and huge numbers of burnout in workforce, outdated technology, economic inequalities, which means that not everybody has equal access to healthcare, increased social fragmentation, and an increased mental health care burden. Quite a lot to deal with. And the question is whether artificial intelligence can be a cure to that. Let's go to the next slide. Just remember, we only saw just the emergence of AI in healthcare. ChatGPT was only launched in November 2022. And by the start of 23, we are seeing some very strong new applications in healthcare. Healthcare partnerships are being launched. In February, Clalit, a large Israeli HMO, has released a strong AI-driven healthcare system. Amazon launched its AWS HealthScribe. Microsoft with Fabric for Healthcare, and Google launching MedLM. So a lot is happening in the field of healthcare and related to AI. But is it really a cure? Let's go to the next slide. How will it transform healthcare? And we need to look at 4 Ps: patient, population, provider, and products. AI can help in predicting the efficacy of treatments, in educating patients so they can be self-monitoring. In populations, we can be identifying and stratifying population, so we can have targeted interventions, also working on health equity. For providers, AI can help automate administrative tasks, taking the burden away from workforce, or optimizing planning and capacity. And in life sciences, in product development, discovering drugs at a significantly accelerated rate, optimizing trial selection, and predicting new threats before they really emerge. So quite a number of fields where we can see the benefits. Let's look at some of the real life examples that we're seeing. Crisis 1, the global workforce shortage, 10 million shortage, 1 in 3 nurses in the US considering leaving the profession. We see some examples between the University of Rochester and ChatGPT, where machine learning is used to model the ED admissions, meaning that the time that doctors are now spending to respond to messages on patient portals, on emergency questions, can be taken over by ChatGPT, a system that's highly reliable. Microsoft and Epic are working together on messaging in the electronic healthcare records, which means that GenAI is now drafting responses to inquiries, and doctors only have to assess them and can send them. A huge benefit. We have to be aware of the risks, however. Almost 8 in 10 respondents to a recent KPMG tech survey said that employee resistance could be a main influencer on the decisions. And we need to take into account, once again, 38 of respondents saying that healthcare is highly risk averse, which means that it can be a barrier to implementation. That needs to be managed. Let's go to the next crisis. Like I said, there is a problem in health equity, with only 50% over 50% of the global population not having access to essential services, or people facing severe hardships because they have to do out-of-pocket payments. Amazon and Who Run AI are solving the issue of cancer care in Rwanda, with only 15 oncologists for 40 million people. GenAI is used to communicate and to track side effects and symptoms of cancer and treatments, making recommendations so that they can be drafted for doctors and they can once again look at these messages, assess them and send them out, being much more predictive. RISA is a tooling that is helping people with mental health disorders, using generative AI to deliver personalized support, which is modeled on therapeutic conversations, thereby helping 56% of the affected adults in the US who do not receive treatment for mental health care problems at this moment. Once again, in the cure, there are risks. We have the risk of embedding inequities in ChatGPT, in machine learning, in data. And we also have to take care of privacy issues. 59% of survey respondents in our tech survey said that strong privacy and security issues have an influence on the priorities in digital strategies. Let's look at a third problem, a third crisis, the focus on curation rather than prevention, the fact that we could prevent a lot of cancers by changes to lifestyle and environmental factors. Clalit, a large Israeli health maintenance organization, is now using a program called CPI, where they run 5 million electronic medical records on a night run through their AI, and in the morning the GPs get an overview of the patients they need to be reaching out to because they are at risk. Just imagine what that does in terms of prevention rather than creation. Ada Health is a symptom checker, which is different from other systems, which is based on clinical, vetted, and regulatory updated knowledge. It treats people, it diagnoses, it triages people, and helps in setting the diagnosis and bringing people further ahead in what needs to be done in terms of treatment. There, once again, we must be very much aware of the risks. Representation of data. Are the populations representatives? That's something that we definitely need to be working on to the future. A fourth example that we're having is the example of AI-powered virtual experiences, a KPMG program where we are creating an AI-powered personalized virtual friend for pediatric care. Just imagine a child having a virtual friend that can prepare him for a procedure by walking him through the facilities, that can help explain what is going to happen in a procedure. With games, how children can do their own rehabilitation, being gamified, and helping them to have less stress, but also helping them and their families to care for themselves so much more better. That's the realm and the art of the possible of AI in healthcare. Now, let's look at the future. We are going towards a future where AI will have a major role in healthcare, and we have to choose a future. Are we going towards a human and machine future, or are we going to let AI happen and have a human versus machine future? What do we need to do in order to chart the right course? We need to focus on the 4 T's of AI in healthcare. The T of trust is the data representative, cybersecurity, privacy, accuracy. The T of transformation, we need to realize that the use of AI will mean that we have to transform the way in which healthcare systems work. So we need to embrace that transformation. We need to train our people and also train our patients to use AI. Only then are we going to reap the benefits. And finally, the T of together, the togetherness and development, having AI technologists, data specialists, doctors, nurses, patients working together to develop the right tooling that we need. But also when we apply AI, having communities, healthcare professionals and patients working together to really reap the benefits of everything that AI has to bring. Personally, I think AI has a strong future for healthcare and can help solve the crisis, but we need to do it in the right way. Thank you.